Recording. Yep. For those who are new, my name is Anjali. I'm one of the tutors working with Langfort. I can see many of my students are here and many of the online students are also here. So yesterday, those who joined are aware that we discussed, we practiced reading part A. So today we will be having a session and we will be doing guided practice. You will be practicing with me reading part B. Okay, all right. So during the session, if you have any questions, feel free to unmute yourself and ask me. And make sure to make your presence known in the class. Make sure, I can imagine some of you might have certain issues with your connections and everything. However, if you can, do unmute yourself and participate in the session. If you have any questions, you can ask me by just, unmuting yourself. Or if you can send me the question personally, you can utilize the chat as well. Okay, all right. Okay. So I can see a few of them are joining in. Okay, all right. So yeah, I hope I'm audible to all of you. So let's start the session for today. Here we go. Yes. Okay. All right. For me, here we go. Right. Right. So, Shiny, can you unmute yourself and tell me a bit about OET reading part B? Whatever it is, whether if it's wrong or not, it's okay. Tell me a bit about yourself. Tell me a bit about OET reading part B.
Ma'am, there will be 6 different extracts.
Okay, all right, you're correct.
And 6 question will be there.
What else?
And each question have 3 options.
Okay, each question has 3 options. You're correct. So, as okay, Marina, can you unmute yourself and give me anything else about part B? So, Shiny told us about the extracts. She told us we have 6 extracts and 6 questions. And she also told us that it has 3 option MCQ questions. Anything else, Marina, from your side? Can you unmute yourself and tell me? Unmute yourself, please. There is an unmute button. Yeah. Okay. Anyone else? Yes. Revati, can you unmute yourself and tell me anything else about reading part B? Yeah.
There are 3 options.
There are 3 options. You're correct. What else?
Separate paragraph.
Okay. You have separate paragraphs. What else? Anything else?
It may be a policy or memo.
Yes, it's Methuka, right? Am I pronouncing your name correctly, Methuka? Hello?
Sir, yeah?
Yeah, Methuka, right?
No, it's my son's name.
Okay.
I am Ratnayak. Yeah.
Can you repeat your name?
Ratnayak. Okay.
Ratna, okay.
Rename.
Okay.
I rename. Okay.
It's okay. It's okay. That's all right. Okay. Yeah. Tell me. Okay. So Revati, what you've told is correct. Yes. Can you tell me? Yeah.
It's maybe a policy or memo.
Okay. Policy or memo. Okay. Let me add a few more details. Part B has 6 questions and 6 extracts. So you will be going through 6 extracts, and these extracts are short texts. And usually you get, as you told, you get guidelines, you get policy documents, extracts from policy documents, manuals, manuals, then notice, extracts from a notice, email, finally, memo. Okay, so these are the 6 different types of extracts that you get when it comes to your OET reading part B. And based on each extract, you will have 1 question, and in total 6 questions. Okay, all right. And your questions will be 3 option MCQs. They will be 3. They are usually 3 option MCQs. All right. Okay, here we go. Then, so in total, as all of you know, in total you have 1 hour 1 hour to complete your reading. Out of this 1 hour, 15 minutes, as we discussed yesterday, 15 minutes we will be spending for part A. We will be spending 15 minutes for part A, and remaining 45 minutes. You have 45 minutes remaining to complete B and C. Part B of your test, part B and C of your test. So out of this 45 minutes, I would say spend 13 minutes to 15 minutes, not more than that, with part B. Not more than that. That's it. More than 15 minutes. Do not spend finding answers for part B. Once you have spent part B, once you have found out enough answers, whether you have completed or not, I would strongly recommend move on to part C. Do not spend way too much time trying to figure out part B. How many answers you can find those, then move on to part C. Okay, so all of you take a second, go through what I've written on the screen. I talked about the questions, the type of text that you usually get, your time, and out of the total time for B and C, how much time you can spend for part B. Take a second, go through this, and if you have any questions, please answer. Please ask me. Okay, all right. So my question to you guys is, Jismi, I can see that you have unmuted yourself. Jismi, can you tell me what's a guideline? What is a guideline? What do you understand by something called a guideline? What does such extract usually convey? Yeah. Yes, Jismi?
They will give some instruction. They will give some instructions about anything.
About anything. Okay, can you be a bit of instructions in what manner? Will it be a random instruction on a random topic, or will it be step by step what to do, what not to do?
Step by step.
Exactly. So guidelines are, guidelines guide you through a specific scenario. So imagine if you are scrubbing before the surgery, when a surgeon, scrubs their hand, what they should do step by step. Guidelines. So guidelines are always procedures or certain things that you are allowed to do, or that you can and cannot do, or that you should be careful of. That's what usually you get when it comes to guidelines. What you can and cannot do, and what you should be careful of. Okay, all right. On that note, Sangeeta, can you unmute yourself and tell me, what about policy documents? What do you usually find when it comes to policy documents?
Policy documents means like rules.
Exactly.
And the regulations.
Yes, exactly. So,
all over, yeah.
Yes, policies, rules, and again, what you can do, or that would be more of a practical scenario. Say there was your patient suddenly panicked and fought with another nurse. In such a situation, according to the hospital policy, what you should do? Okay, so it's not a medical. It can be a medical scenario. At the same time, it's more of rules and regulations, the policies. What you have to do, or what you need to do, what paperwork should you file, all those things, those types of things comes under policy documents. Okay, all right. So that brings me to Adira. Can you unmute yourself and tell me, what about manuals? Unmute yourself, Adira. So what about manuals? What type of information can you get from a manual? Yes. Any of you, if you're talking to me, make sure that you have unmuted yourself so I can hear you. Yes? Okay. All right. Kalani, what do you think you get under manuals? When I say manuals, what comes to your mind? Unmute yourself, please. Yeah. Yes? Yeah.
Actually, I have no idea about.
Okay, take a second. Kalani, take a second. When I say manuals, so imagine you bought some new furniture from a particular shop and you get a manual. So what does that manual usually contain?
Instructions. Like a handbook?
Instructions on how to, is it instructions on any random thing, or it is about that particular piece of furniture?
Okay.
So how to assemble it, how to use it. That's what, so manuals are usually focused on an equipment. So for instance, CPM machine or a new machine that has arrived in your hospital, how to operate it, what you can do, what is the purpose of a specific part of the equipment. That's what manuals usually convey. So guidelines about situations in what you can do, what you cannot do, step by step. Policy documents are focused on rules and regulations. Manuals are usually for equipments and stuff like that. Which brings us to notice, email, memos. Okay, so can you guys take a second, think about it and tell me what type of information can we get from a manual or a notice, an email or a memo? If you get a memo at your hospital, or if you get an email from your hospital, or a notice in a notice board, if you find a notice, what type of information do these things convey usually? Yes, can you guys think about it? Take a second, think about it and tell me. They have a common scenario, notice, email and memo. Yes.
It's maybe a internal circular.
Yeah, internal circular, but usually internal circulars are sent in to convey what things? You guys are
Any
correct.
updation?
Updation, very good, updation. So usually updation, updates, reminders, or something completely new. Something completely new. These are the type of information that you can get from a notice, an email, or a memo. So updates or changes, okay, something. So something was already there. For example, vaccination policy for the staff. Something has changed. So they are updating you through an email or through a memo or a notice. Okay, or reminders. So there is already something already there. They are reminding you about it. Maybe something happened. So yesterday a patient slipped and fell down in the ward. So all of you know how to take care of such a situation. However, because of that incident, the department is sending you a reminder through an email. What to do, again, reminding you. Or completely, something that is completely new. A new policy has been, issued. Or something completely new, rule or regulation or something new. It can be anything in a hospital or a workplace scenario. So these are the types of things, the types of information that you can find in these types of extracts. Guidelines, policy documents, manuals, notice, email, and memos. All of you take a second, go through this and ask me if you have any questions. All of you. Okay, all right. So any questions for me so far, especially those who are joined, those who are very new to OET, take a second, go through this and ask me if you have any questions. Okay, all right. That brings me to the types of questions that you get when it comes to question types, when it comes to your part B of your reading. Usually, you might need to find out the main idea of your extract or purpose of your extract, or they will focus on a specific detail. They will focus on a specific detail. Okay, so they might ask you to find out the main idea, purpose, or they might ask you to ask a question focused on a detail given in that extract. So these are the types of questions that you get when it comes to part B. So part B has 6 extracts, 6 questions. These extracts are often taken from guidelines, policy documents, manuals, notice, email, memos. And out of your 1 hour, you get 45 minutes to do attempt your part B and C. Out of this 45 minutes, I would recommend that you utilize not more than 15 minutes when it comes to part B. And usually you get these 3 types of questions in part B. So Binsi, Marina, Anita, Jismi, Shiny, Priyamol, Priya and Tindi, Athira, Sangeeta, Kalani, Revati. Any questions for me and others as well? Any questions for me so far? Okay, all right. Okay. So now we are moving on to the practice and I want all of you to participate. Yes, you might say the wrong thing. That's okay. But I want you guys to participate. Otherwise, it will be just me talking. So when I ask you, just unmute yourself and tell me what you feel at the moment as the answer, or tell me your opinion when I ask you the question. Okay. All right. So shall we move on to the practice? Okay. Yes. Tell me, unmute yourself. Shall we move on to the practice?
Yes, ma'am.
Yes, and I want you guys to participate. I know many of you are not familiar with the online setup, so it might be a bit difficult at first. Just unmute yourself and talk to me. Okay, all right. Here we go. So we are going to have a look at practicing reading part B. So let me tell you one thing. Yeah. So usually many institutions and many of my students do attempt part B in 3 different ways. 1 second, I'll write that down in a second. Yeah, here we go. Yeah, many of them start with the question, then they move on to the extract. So they read the question, then what they do is they move on to the extract or the text, then they move on to they look at the options. Okay. Many of my other students, what they do is they read the question. Sorry, they read the extract first, then they read the question, followed by options. These 2 methods, I'm on board with you. Any of these would be okay. You will be able to, it will definitely help you to be find out your answers in a very practical way. It's not at all a problem. These 2 ways, question, extract, options, extract, question, options. These 3 ways of approaching part B, it's okay. They are good. These 2 ways of approaching part B are okay. However, there is a third method which I've seen many of you do. That is, you guys start with question, then move on to the options. After that, only after reading the question and the options, many of you come to the extract. I would strongly recommend you guys not to do it. I would ask you not to do this. This is not something that I would recommend, because if you read the option and if you read the question again, it can be quite confusing. It can be quite, because you will never be able to, many of us will not be able to understand or reject the wrong options. So do not read the question, option, then come to the extract. This is not something that is recommended. It will confuse you, and you will not be able to figure out which is the correct option. Okay, so the first 2 methods are all right. I would say this one is okay. This method is okay. This is okay. This not so okay. Okay, so take a second, go through this and just think what you usually do. All of you. Reading the question, reading the text, then going to the options, completely fine. Some students are comfortable reading the extract, then looking at the questions and options, completely okay. I wouldn't say it's wrong. I would say that's okay. But the last method, no. It's a big no from my side. I wouldn't recommend that. Take a second, all of you. Yes, right. So today, we are looking at this one. We will read the question, we will analyze it, then we will read the extract, then we will choose the most appropriate option. This is the best method, and this is what I usually do, and this is what I would recommend you to do, and this is what OET has asked students to do. Read the question, analyze the question, read the extract, then look at the options. Okay, all right, so let's go. We are going to do what I just told you right now. Here we go. Let me take the extract. Yes. So, I hope all of you can see the screen. Okay. All right. So, 1 second. Yeah, here we go. Right. So, Shiny, can you read the question for me? Just the question, nothing more, nothing less. Yes.
This extract from the policy document aims to ensure that
1 second. This extract from the policy document. So as soon as we read the question, we know that we have just read, we are going to read something from a policy document. This extract from the policy document aims to ensure that. So, is this a complete question? Is this a question that ends in a question mark? It is not.
no.
So such questions are called incomplete questions. Okay, usually we call it as incomplete question stem. Okay, so we have a question that is not a complete a question that ends with a question mark. Rather, it's our option, whichever option we choose, that completes the sentence. So such questions are called incomplete question stem. So all of you, take a second, read the stem. Do not look at the options. Do not read the extract. Just take a second and analyze your question. All of you. Okay, Tindy, can you unmute yourself? Can you unmute yourself and tell me? Tindy, can you unmute yourself and tell me? What have they asked us to figure out based on the question? Only by looking at the question. What should we find out from the text? Or what have they asked us to find out from the policy document?
Anything aim, policy aim.
Policy aim, okay, correct. Okay, a little more. Aims to do what? Not the aim, what it aims to?
Aims to ensure.
Ensure. Very good. So, we need to find out not what is the aim, what does it aim to ensure? What does the policy aim to ensure? So, it's not about the aim of the policy, rather what is it trying to ensure? What does the policy aim to ensure? Aim to ensure. Okay, so this is what we need to figure out. So all of you, when it's a multiple choice question and when you read the question, after you read and analyzed it, think like this: what should I figure out? What have they asked me to find out? So whether it's a complete question or whether it's an incomplete question, make sure you analyze your question and get an answer for what have they asked us to find out. Shaimi, Revati, Anita, Jismi, Tindy, Athra, Sankita, Priya, Shiny, Marina, Vinci, Khalani, and others. Are you guys with me so far? Did I convey myself clearly?
Yes, ma'am. Yes, ma'am.
So I've asked you to read the question and ask yourself, what should I find out? Okay, so we know we need to find out what does the policy document aiming to ensure? What is it trying to ensure? Okay, keep that in mind. I'm going to give you 50 seconds, 50 seconds, almost a minute. I want you to read the extract. All of you. Focus on the screen and read it. Read the extract. Read and understand the extract. All of you. Okay, that's it. So, Priya, Priyamol, can you unmute yourself and read the heading and the first sentence for me? Unmute yourself, read the heading and the first sentence. Yes? Yeah.
Okay, ma'am.
Yeah.
Pediatric discharge. It is
So,
a policy.
one second, Priya. Pediatric discharge. Pediatric means kids, discharge of the kids. So, that's what we are going to go through when it comes to the extract. Continue, Priya.
It is a policy of this hospital that upon their child's discharge home from the undil, all parents will receive written discharge advice about their child's hospital stay using the admissions, discharge, and transfers navigator.
Navigate. Okay. It is a policy. So they are talking about a rule of or policy of this hospital that after the child's discharge home from the unit. So after you discharge the child from the unit, from the hospital unit, all parents, or the parents of the kids will receive written discharge advice. They will give discharge advice in written form about their child's hospital stay, what happened in hospital, using a system called Admission, Discharge and Transfers Navigator. So using the system, once the child has been discharged from the unit, the parents of the kid will receive discharge advice about the kid's hospital stay in written form. Next sentence, Priya. Unmute yourself. Next sentence. Yeah. Yes.
And after visit summary can be printed for the family along with any attendance certificates.
So what they can do, they can give a printed copy of after visit summary for the family along with something called attendance certificates. Yes, continue, Priya. Yeah.
The alias includes a minimum data set which incorporates name of consultant, and follow information and a phone number to contact more is information.
Yes, correct. Okay, let's see. The AVS, this particular, after visit summary includes. So now they are looking at the content of the after visit summary. So it includes the name of the consultant, who the kid was consulted by, diagnosis of the patient, medication plan, follow-up information, and phone number that they can contact if they need any more information. So they told the parents will receive a written document. They told that about the summary that will be printed with attendance certificate, and they're talking about what will the summary contain. What are the pieces of information they can find in the summary? Yes, Priya, can you read the last sentence for me? Yeah.
This clearly set out to our kind.
Continue.
Clinicians should also document in the progress notes that the discharge advice has been given to parents at the time of discharge.
So this is clearly, so what they just told now is clearly set out, is clearly made to avoid any confusion of any kind. So, giving an in-detailed plan with the phone number that they can contact, all these things is clearly set out, is clearly, made, set or, is in place to avoid any confusion. Then they are also told clinicians, doctors and, clinical staff should also document. They also should keep a document or, keep a note or in the progress notes that the discharge advice has been given to the parent at the time of discharge. So at the time of the discharge, they have in the progress note, they also have to make a note that the parents have been given a discharge advice. So they need to write down the discharge, everything about the hospital stay as per the navigator in a written form for the parents. Then they need to they can also get an after visit summary, which the content is also given. And all these are done to avoid any kind of confusion. Then they are saying at the end, clinicians should document everything or document if they have given advice to the parents at the time of discharge. Okay, so all of you take a second. Do you have any questions about the extract? All of you. Okay, I believe the extract is pretty clear. So we have read the extract. Now we know what we are looking for. And don't forget about our question. Our question states that we need to find out what is the policy document aiming to ensure. So let me tell you one thing. If your question is an incomplete question, whenever you read the options, read them together. Read each option with the question if your question is an incomplete one. Sangeeta, can you unmute yourself and read the options with the question one by one? Yes.
This extracts from the policy documents aims to ensure that the appropriate software to use for discharge.
So take a second. Do you think the whole text extract the document was talking about or was aimed at ensuring that the appropriate software, they use the right software for discharge to do the whole discharge procedures? Is that what they were talking about? Do you think is that the answer? Shaimi, Binsi, Adira, Jinsi, what do you guys think? Is it about the software?
No.
No, but they do mention it once. But that is not what the entire document is trying to convey. So we can say that yes, they mentioned one software here, but they don't. The whole document is not trying to convey that you have to use the appropriate one. No. So okay, which brings me to the second option, Sangeeta. So we can reject this. Yes, next one, Sangeeta.
This extracts from the policy documents aims to ensure that families are fully informed of discharge arrangements.
So is the policy trying to ensure that families are fully informed, they have enough knowledge of what happened, of the discharge arrangements, what arrangements we have made at the time of discharge? Is that what the policy trying to convey, trying to ensure? What do you guys think? What do you think? Okay. Okay, might be, right? They do mention families a lot, but let's wait. Let's look at the last option as well. Sangeeta, the last option.
This extracts from the policy documents aims to ensure that the role of the clinician in discharge is clearly understood.
Do you think is that what the extract trying to convey? Is it trying to convey the role that everybody clearly understands the role of the clinician during the discharge? Is that what it's trying to convey?
No.
Yes, no. They have, okay, I agree that they have mentioned clinicians. At the end, they've asked clinicians to make a note if they gave advice to the parents. But do you think the whole policy document is aiming to ensure that is the document trying to ensure that the clinician's role is clearly known at the time of discharge? Do you think that is the answer? What do you guys think? Yeah?
No.
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 So what is the best option?
B.
So Kalani, what is our best option? B.
It's B.
B. So be very careful. Okay. Here, many of my students often do, oh ma'am, they have given clinician here. They have given clinician at the end. So that is the answer. No. No. You cannot do matching of the option with matching with the words of the option to the words given in the or the topic given in the text. Look at the content. Look at the meaning. So we know the answer is B. The policy is trying to ensure families, parents of the kids are fully informed, right? They can get a written discharge advice, they can get a printed one, and they have also told the content of those printed one. Then they have told we have said this to avoid any confusion, and they're also asking the clinicians to give advice and note that down in the progress notes. So the whole thing is trying to ensure families are fully aware of the discharge arrangements. All of you, take a second. Go through what we did so far. Try to, go through everything that we've discussed so far and ask me if you have any questions. All of you. Look at the question, look at the extract, look at the way we found out the answer. Yes, Binsi, Shaimi, Kalani, Adra, Priya, Tindi, Jismi, Anita, Marina, Sankita, Revati. Any questions for me? Have I conveyed myself clearly why B is the answer? Yes?
ma'am.
Yeah. Okay. All right. So on that note, shall we move on to the next question? Here we go. Right. 1 second. Anita, can you unmute yourself for me? Is it possible? Can you unmute yourself?
Yes, ma'am.
Yes. Anita, can you read only the question? So all of you, I want you to, here we go. 1 second. Let me zoom it. Yeah. I want all of you to take a second, read the question. Yeah. Anita, you can read the question for me. Yes.
According to the memo, GP with the patient attending as a outpatient should.
Okay, 1 second. No, don't read anything yet, just the question, not the option. So let me give you a hint. Whenever there is should at the end of an incomplete sentence, that means something the person should do. They should, something about their action, usually in the future, or something they have to do always. Should always indicate something, an action they have to do in the future, or they have to do always. Keep that in mind. Now let's analyze the question. The question, according to the memo. So we know we are going to read a memo. GPs, doctors. So our memo talks about GPs with patients attending as outpatients. So according to the memo, as per the memo, GPs with patients, the doctors, general practitioners who have patients attending, who comes as outpatients, should. So all of you analyze the question and tell me, what are we supposed to follow? What have they asked us to find out? What have they asked us to find out? Yes, Shimi, can you give me some, tell me what have they asked us to find out here? In your own words? Yes.
GP should, patient should do something.
Yeah. Is it okay? No. Is it the patients? Take a second. Take a second. Shiny, take a second. Are they talking about what the patients should do? Or Shimi, you were saying, Shiny, take a second, read it. Shimi, you were saying?
GP should. Yes, ma'am.
Who should do? GPs should do.
GPs.
So what should, see, we are interpreting our question. Do that. Many of us fail to do this particular step. We are so much focused on quickly completing. We forget this step. You read the question. Now we are analyzing it. What should GPs with outpatients, right? Patients as outpatients do? What should they, outpatients, do? What should the GP? So based on the memo, what have they asked GPs with outpatients to do? Okay, so all of you take a second, understand the question. All right. Okay. All of you clear, right? Shall we move on to the extract? Here we go. Take 50 seconds, 50 seconds. All of you, Kalani, Binsi, Marina, Shiny, Sankita, Adira, Priya, Tindi, Anita, Jismi, all of you, read the extract. You have 50 seconds, 50 seconds, almost a minute. Pay close attention and read the extract. That's it. That's it. Anita, unmute yourself and read the 2 headings and the first sentence for me. Unmute yourself, Anita. Yeah. Yeah. Hello, Anita? Okay, that's okay. Yeah, Anita, can you read the 2 headings and the first sentence? Yeah.
Okay. Memo to all local general practitioner patient mail service.
Okay, so it's a memo to all the local GPs. Local GPs means GPs in the locality. Okay, and what is the topic? Patient email service. They're talking about the email service for patients. Yes, Anita, continue.
The new patient mail service is open to all patients who are registered with a general practitioner in the area and mean they can receive information directly through the mail inbox rather than through the post.
1 second, Anita, let me clarify this. So, the new patients, so they have a new patient email service that they've just introduced. And they're saying it's open, it is available to all patients. What type of patients? Who are registered with the GP, with the doctor in the area. And this service means they can get the information directly through their email instead of through their post. Instead of the postal service, they can receive whatever information that they need via an email. Okay, next sentence, Anita.
The service is option and is open to the both patients who are currently receiving hospital treatment and those who are not. The
So
service.
this, 1 second, Anita. So this particular service, this email service is available for everyone. This particular service is available for both the patients who now are undergoing treatment and those who are not taking treatment, but they are not, even though they are not taking the treatment, even they can avail these services. However, it's optional. Nobody is saying it's mandatory. It's their choice. Whether they are a patient or whether they are not a patient, they are right now not receiving treatment. They can have access to the service, but it's not mandatory. Next one, Anita. Next sentence.
The service provides fast delivery of information and allow additional information to be sent along with the appropriate letter.
Appointment letters. Okay. So this service, this email service gives fast delivery without wasting any time. They will get the information, and it helps extra information to be sent. So if any extra information is there, that can also be sent along with an appointment letter. Okay, so fast delivery of information, extra information can be sent along with the appointment letter. Yes, Anita, next sentence.
All mails will be password protected to ensure confidentiality.
All emails, so this email, the entire thing is protected via a password. Then this will ensure confidentiality. Confidentiality means privacy is kept. That aspect is ensured by this password. Yes, Anita, next 2 sentences you can read. Yeah.
Patient can sign up through the hospital website. They will be asked to provide their name, data, date of birth, NHS, number of the mail address.
Okay, so they can sign up to the service via through the hospital website, and when they try to sign up, they will ask for their name, date of birth, NHS number, and email address. Final sentence, Anita.
Please mention to the patient that this service is now available when making a referral for outpatient appointments.
So if anybody is taking outpatient appointments, they can also, this service is available for them as well. What service? This whole service that we are discussing so far, that is available for patients who are trying, when they try to go for a referral for outpatient appointments. So all of you take a second, quickly go through the extract. If you have any question, if you have any confusion, ask me.
No, ma'am.
Okay, all right. Which brings us back to the question. Now let's have a look at the option. So here again, question is an incomplete one. For clarity, read the question with the option. So Shimi, can you read the first option with the question?
The GP with the patient attending as outpatient should provide them with access to a new service.
1 second. GPs with patients attending as outpatients. So GPs who have patients as outpatients should provide the patient with access to the new service. Are they asking the GPs to give the patients ability to access the new service? Are they asking the GPs to provide the access?
No.
No, right? They're not asking the GPs to provide access. Access means the way they can access it, their ability to use it. Are they asking GPs to provide it? No.
No.
Next one, Shimi, next one.
GP with the patient attending us or patient should inform them that letter will no longer be posted.
Anywhere have they talked about a letter not being posted?
No.
No. So that is
No.
not our option. That is not our option. Okay. Next one. C. Can you read the option, Shimi? Next one. Yeah.
GPs with the patient attending as outpatient should ensure that they are aware of the new arrangements.
Who are they? Outpatients. Patients who want to be outpatients. The GP should make sure that they are aware of the new arrangements. Why is answer? Answer is C. Why is that? Look at the last sentence of the extract. Please mention. So they are asking the GPs to mention to patients that this service is, the new service is available for outpatient appointments. So that's what C is trying to convey. All of you take a second. When they said, please mention, that means ensure that when you mention something, you're making that the other person is aware. So answer is C. It's not A. They are not asking GPs to give them access to the new service. No. They can access the service through the website. They don't need the GP's help. So the answer is C. All of you take a second, go through that. Answer is C. Look at the last sentence. Because of the last sentence. Please mention. Shaimi, Marina, Kalani, Revati, Anita, Priya, Tinti, Jismi, Atira, Sankita. Any questions? Are you guys clear with this?
Yes, ma'am.
Okay. So they are not, let me tell you, don't be like, okay, GP should provide. No, GP should provide nothing. They just have to mention it to their patients. They don't have to give anything. Patients will do everything. Getting access to this, everything the patients will do on their own. GP's duty is at the end, they have requested the GPs to mention it. That is why the answer is C. Okay, all right. Revati, Adira, clear? Any questions?
Clear, ma'am.
Okay, all right. Which brings me to the next one. Next question for today. So this is a complete question. Marina, can you unmute yourself if you don't mind, and can you read the question for me? Yeah.
What do the guidelines say about the hangover of pediatric patients?
What do the guidelines? So that means analyze the question, all of you. Shahida, I can see you've just joined in. It's okay. We are attempting a new question here. So just focus. So what do the guidelines? What do the guidelines? So we know we are going to read a guideline. Say about handover of pediatric patients. So that means we know the guidelines talk about pediatric patients. Handover. So we need to find out what exactly is, what is told, what is mentioned, or what is conveyed about handing over of pediatric patients. I'm just saying, putting kids means pediatric patients. So what is conveyed about the handing over of kids in the guidelines? All of you, take a second. Look at the analysis of the question. We know we are going to read guidelines. We know the topic is about kids. And what do the guidelines say? So what is it trying to convey? What is it trying to convey about what? The handing over of pediatric patients. All of you are clear with the question? Okay. Please read the extract. Take 50 seconds, 50 seconds. Read the extract. That's it. Kalani, can you unmute yourself and read the heading and the first sentence for me? Yeah.
Yes. Patient care handover procedure, pediatric ward.
Okay. Patient care handover process. So they're talking about handovers in pediatric ward. Yes, Kalani, continue.
Pediatric ward. Handover should occur by each patient's bedside.
Bedside. Yeah.
Bedside. If this is not appropriate, it should occur outside the patient room. And if possible, parents are encouraged to participate in handover and must be aware of the plan for their child for the next shift.
Okay, all right, let's have a look at it. Handover should occur by each patient's bedside. So who are our patients? Patients are our kids. So when they hand over, when one shift moves to the, when the shift change happens, when they hand over, it should happen near the patient's bedside, the kid's bedside. If this is not appropriate, so if considering the situation, if this particular approach is not appropriate, it can happen outside the patient's room. And if available, if they are available, you need to encourage the parents of the kid or kids to participate in the handover, and they must know the plan for their child. What plan you have? What have you planned for the child with the next shift? So, if possible, near the bedside. If that is not appropriate, outside the room. And if parents are available, encourage them to be a part of this handing over thing, and make sure that they know that what you have they must be aware. They should know, they have to know what you have planned for their kid for the next shift. Okay, Kalani, next sentence, Kalani, next two sentences, next whole sentence. Yeah, from here till here.
Handover must be completed in the ISBAR format, utilizing the handover function in electronic medical record within brackets EMR and recorded therein.
Okay, all right. Give me a second. Handover must be completed. So you have to do the whole thing in the ISBAR format, ISBR format. And when you do that, you need to use the handover function. There is a function in the electronic medical record system. You need to use that and record whatever you need to record. Okay, so in the ISBAR format, in this particular software that is called electronic medical record, you have to record during everything that happens during the handover. Next sentence for me, Kalani.
Patient identification must be incorporated as per the patient identification procedure, and clinical alerts need to be included. For example, allergies and infection control precautions.
Okay, so when you file these things, you need to make sure that you add the identification details of the patient according to the procedure. And if the patient has any allergies or any other infection control precaution, something that can be considered as an alert, you need to include that as well. Yes, continue, Kalani.
Lastly, the patient-family communication boards must be updated accordingly.
So there is a the patient or family communication board. So there is a board that conveys that includes the patient-family communication. What communication you have had with the patient or the family, that also should be updated accordingly. So when during the handover, you have to do this as the final step. Last sentence. Can you read that? Yeah.
The staff member who is responsible for the care of the patient and the staff member taking over that responsibility should conduct the handover.
So the staff member who is, who is responsible for the care, and the person who is taking over that responsibility, they should do the whole thing. Okay, so it should happen near the patient's bedside. If that's not appropriate, it can also happen outside the room. And you make sure that you encourage the parents to be a part of the whole thing, and you make sure they must be aware. If they're available, they should be encouraged to participate, and they must be made aware of the plan, whatever plan you have for their child during the next shift. And you need to do the whole recording thing using ISBAR format in this particular software. When you do that, you need to clearly give the identification details of the patient, and if there are any clinical alerts that also should be included. Then you need to update the patient communication with the family and the patient, whatever it is there, those details you need to update. Finally, the person who is responsible for the care and who is handing over, who is going to receive the responsibility, these two people should be involved in the procedure. Okay, so Are you guys clear with the whole thing? Any questions? Yes? Okay, any questions? All right. That brings us back to the question. So here, see, our question is a complete question. See, it ends with a question mark. So, and we know we need to find out what exactly are they trying to say about the handover of the pediatric patients. Okay. So, Shiny, can you read the options one by one?
This should take place at the bedside.
Is that what they are saying? That this whole thing should only take place at the bedside? Yes? Tell me. Can A be the answer?
No.
No, because you have another option as well, right? So they cannot say this should take place. No. Okay. All right. Next one. Next option. Shiny. Yeah.
Parent needs to be involved or fully informed.
So you need to involve the parents, or you need to inform them of everything.
Yes.
That can be an option. But let's wait. Let's see the final one. Final one as well. Yeah. The person who was reading. Yeah. The final one.
Notes may be made in either electronic or handwritten form.
Okay, they talked about electronic, but have they throughout the thing have they mentioned about any handwritten form? No. So the best option is B. See, they've asked the parents, encouraged the parents to participate, and you make sure they are aware of the plan. So the best option is B. Okay. All right. Any questions? Any confusions about this one? Any confusions? All of you. Any questions? Any confusions? Do you need any clarifications? Okay. All right. Which brings me to the next question for the day. So this is an interesting question. Sangeeta, can you read the question for me? Yeah.
The purpose of memo about IV solutions bags is to remind health practitioner.
So what, all of you, take a second, read the question and tell me what do we need to find out? Analyze the question and tell me what have they asked us to find out? Okay, so we know we are going to read a memo. And the memo talks about IV solution bags. So what do we need to find out, Sangeeta? Anybody, Priya? Shiny? Yeah.
Health practitioner.
No, wait a second. No. We need to find out the purpose of the memo. Okay, don't focus on one word as a whole unit. Okay, we need to find out the purpose of the memo. Okay, 1 second. Okay, the purpose of 1 second. What is the purpose of the memo? Trying to remind us. What is the purpose of the memo? What it is to remind. Okay, 1 second. 1 second. What is the memo trying to remind us? Remind us. That's what. Okay, through its purpose. Yeah, that can be a good way of analyzing it. Yeah. So it has a purpose, and what is that purpose trying to remind us? So basically, what is the memo trying to remind? Not us, sorry. Remind the health practitioners. Remind the health practitioners. What are they trying to remind the health practitioners? Okay, all right. Right. So we need to read it, understand the purpose, and we need to figure out what is it trying to remind the health practitioners. All of you, take 50 seconds, go through the extract, read and understand the extract. Yes, that's it. Okay, all right. Jismi, can you unmute yourself? Read the heading and the first sentence for me. Yes.
Memo to staff, intravenous solution bags.
Mhm.
IV fluids are administered via a plastic IV solution bag, which collapses on itself as it empties.
So here they're talking about, it's a memo that's for the staff, and it talks about intravenous solution bags. It talks about IV bags. So it says IV fluids are administered through a plastic solution bag which collapses on itself as it empties. So all of you are very much aware of this. When the IV bags, it has, it is finished, what happens? It shrinks, right? It collapses on itself as it empties. That's what it has told. Next sentence, Jasmine.
When a bag is disconnected by removing the giving set spike, air can enter the bag.
So when you disconnect by removing the set spike, there is the air can enter the bag. Yes, continue, Jasmine.
If it is then reconnected to an IV line, air can potentially enter the patient's vein and cause an air embolism.
So when you disconnect it, there is a chance for air to enter, and if you then reconnect that IV line, though that air can enter the patient's vein and cause an embolism, air embolism. Next one.
For this reason, partially used IV bags must never be respiked.
Okay, so because of this particular reason, if it's one second, yeah, because of this particular reason, you should never respike, reuse or respike the bag if it has been already used. Next sentence, Jasmine.
All IV bags are designed for single use only, for use in one patient and on one occasion only.
Okay, so so all IV bags, they are designed in such a way it can only be used for one patient and for once. Next sentence.
All registered large volume injections, including IV bags, are required to have this warning or words to the same effect clearly displayed on the labeling.
So that IV bags can only be used once for one patient for one occasion. This particular thing can be should be found as a warning, or it should be clearly displayed on the IV bag. That's what it says. Next sentence. Yeah.
In addition to the potential risk of introducing an air embolus, respiking can also result in contamination of the fluid, which may lead to infection and bacteremia.
So if you do the respike, if you do spike the IV again, along with the risk for air embolism, it can also result in contamination of the fluid inside the IV bag that can lead to infection and bacteremia. Okay, so it basically says the feature of IV bags being collapsing on its own after it empties, and if disconnect it, there is a chance for air to enter, and if you reconnect that again, that can enter the patient system and cause an embolism. That's why you should never respike the used IV thing. And once, if it's partially used, IV bags should never be respiked. And all the IV bags are designed in such a way you can only use it for one patient at one time, and this particular thing should be given as a warning over the label. And if other than the air embolism thing, it can also cause if you do the respiking again, it can also cause contamination of the fluid inside it, and that can lead to infection and bacteremia. All right, okay. So Jasmine, can you unmute yourself and read the question with the option? See, this is an incomplete question, so can you read the first option with the question?
The purpose of the memo about IV solution bags is to remind the health practitioners of the procedure to follow when using them.
So the purpose of the memo of IV solution bags is to remind health practitioners, the doctors, it is to remind the doctors or the health practitioners of the procedures to follow when using them. Is that it? Is the whole passage talking about, extract talking about what step by step the health practitioners do when they deal with IV bags? Is that it? What do you guys think? Yes, is the answer A?
No.
Okay, just means next one. Nowhere it's talking about step by step what they should follow. So answer is not A. Just me next option with the question.
The purpose of the memo about IV solution bags is to remind health practitioners of the hazards associated with the faulty one.
So are they talking about the hazards or the dangers associated with the faulty one? So is this extract trying to remind the health practitioners about the dangers connected to faulty IV solution bags? What do you think? Have they talked? No. So that automatically makes the answer C, but let's, can you read it, just me?
The purpose of the memo about our IV solution bags is to remind health practitioners why they shouldn't be reused.
Right? They are asking us again and again, they've asked us why they shouldn't respike it, right? So respike, reuse. So answer is C. All of you, if this is pretty straightforward, but take a second, see that? And I am sure you guys are very much familiar with the topic as well. So this shouldn't be that difficult for you. Take a second, go through it. Right. That brings us to the second last question of the day. Okay. All right. Here we go. Adira is here. Yeah. Adira, can you unmute yourself and read the question for me? So those who have just joined, we are discussing part B of the reading. We are discussing how to attempt part B, and we are doing the guided, we are practicing it together. We are doing the 5th question for today. Adira, can you unmute yourself and read the question for me? Yeah.
Yes, ma'am. What do we learn about the use of TENS machine?
So here they have not given whether it's a memo, guideline, we don't know. But what do we know? We know we are discussing the extract is all focused on TENS machines. So we need to find out what do we learn after reading the extract. What do we learn about? What do you get to know? What about TENS machines? So it's pretty straightforward. Take a second, all of you. So we need to find out among the 3 options from the extract, what do we learn about TENS machines? So take a second, read the extract. 50 seconds, not a second, sorry. 50 seconds, read the extract. All of you. Right, that's it. That's it. Adira, can you read the heading and the first sentence for me?
Update on TENS machines. The Association of Chartered Physiotherapists in Women's Health has an expert panel which could not find any reports suggesting that negative effects are produced when the TENS has been used during pregnancy.
So here they are talking about using of TENS during pregnancy, and they're saying that the Association of Physiotherapists who focuses on women's health has an expert panel. So they had a panel, they had a discussion. Panel is nothing but all the experts come together and discuss something. So they're saying based on the panel, the panel could not find, they could not point out any reports that suggest that using TENS during pregnancy has any negative effects. So there was a panel of experts, and they during the discussion, it was clear that they couldn't find any reports that say that using TENS machines can be dangerous. Okay, can be problematic. Next sentence, Adra.
However, in clinical practice, TENS is not the first treatment of choice for women presenting with musculoskeletal pain during pregnancy.
So all of you take a second. First, not the first treatment of choice. What does that mean? It is not the first treatment of choice. What do you understand by that? Is it the first option? No. It's not the first something when it's not the first choice. Yeah.
No.
No, yes, exactly. When something is not the first choice, we say it is not the first treatment or first choice. So that is not something that they usually choose first, especially for women who has musculoskeletal pain during pregnancy. So they are like, nobody could find any fault with TENS, but TENS is not the first choice when they treat women who has musculoskeletal pain during their pregnancy. Okay, next sentence, Adra.
The initial treatment should be aimed at correcting any joint or muscle dysfunction, and a rehabilitation program should be devised.
So they're saying first what they should do, they should focus on correcting any joint dysfunction or muscle dysfunction. Then they should come up with a rehabilitation program. Continue.
However, if pain remains a significant factor, then TENS is preferable to use of strong medications that could cross the placental barrier and affect the fetus.
So first what they will do, it's first place is TENS is not the first choice. What is the first choice is correcting the joints and muscle dysfunction, then coming up with a rehabilitation program. And even after doing that, however, if after doing that, if the pain is a serious thing for the patient, then they're saying that we need to go prefer TENS instead of strong medication that can cross the placental barrier and affect the fetus. So after after trying to correct the muscle dysfunction and the rehabilitation program, if the patient still has pain, then they should go for TENS instead of strong medication that can enter the barrier, cross the barrier and affect the fetus. So instead of that, they need to use TENS. Last two sentences, Adra.
No negative effects have been reported following the use of this modality during any of the stages of pregnancy. Therefore,
continue. Sorry.
TENS is preferable for the relief of pain.
So no negative effects. They have not found any negative effects or reported any effects following the use of this modality, this mode of things, this module of things. So whatever they have just told, following this in any stages of pregnancy has not resulted in any reports of negative effects. That is why TENS is preferable for the relief of pain. All of you take a second, go through this. They start with how TENS does not have any negative effects during pregnancy as suggested by a panel. Then they say that, however, it's not the first choice if the patient has musculoskeletal pain during pregnancy, then they will come up with a treatment that will correct the joint dysfunction, and then they will go for rehabilitation. Only after that, if the patient has, significant amount of pain, they will prefer TENS instead of medication that can affect the fetus. So doing this, what they just told, this modality has no negative effects about the modality have been reported. So that is why TENS is preferable for getting relief from pain. Okay, all right. Which brings us to the options. So, Revati, can you unmute yourself for me and read the options one by one? This is a complete question. We know we've already looked at the question. What do we know? What do we learn about the use of TENS machines? Yes, Revati, one by one.
Evidence for their efficacy is unconfirmed.
So, nurses, what do you mean by efficacy? Efficacy. How effective something is. How effective. Okay, so evidence of how effective they are is unconfirmed. Have they told that the proof of their effectiveness is not confirmed? Have they said that anywhere?
No.
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 They have not talked about the proof, or they said that there are no reports, but nowhere they have said that, evidence and, proof of their efficacy. No, that's not told. Next one. Yes, next one, Revati.
They are recommended in certain circumstances.
They are recommended. TENS machines are recommended, are preferred in certain circumstances. What do you guys think?
There is a chance.
There is a chance, but let's look at this. Look at the C option. Revati, C. Can you read the C? C option.
More research is needed on their possible side effects.
Throughout the extract, have they mentioned anywhere about side effects and more research?
No.
No. So, of course, our option is B. So we have rejected all the note given and the something that has nowhere. Both A and C are not at all given in the extract, so that makes B as our answer. We have rejected those two, and B is our answer. I think this was pretty straightforward. So I'm not taking much time on that. Let's move on to the last question for today. I need all of your attention. I know reading can be boring, but I need all of your attention. I would like you guys to focus on the question. 1 second. Priya, can you read the question for me? Unmute yourself and read the question for me. Unmute yourself, Priya. Yeah. Okay, that's all right. Shaimi, I can see that you have unmuted yourself. Can you read the third question?
If surgical instruments have been used on a patient suspected of having Brown disease, they...
1 second. Yes, correct. You're right. If surgical instruments, so this extract is focused on surgical instruments. If surgical instruments have been used, if you use surgical instruments on who? A patient suspected, not sure, possible of having prion disease, they. So whenever if comes, so imagine if you do this, this might happen. So that is the formation of the sentence. If you get such question, imagine we need to find out whenever you get questions, or if your part B or any part question starts with if, it always talks about what might happen, what will happen. Okay, so we are imagining a situation and we are saying what will happen. So here we need to find out what will happen in what situation. All of you, can anyone tell me what will happen? Yes, I've given you the hint of the question. What will happen? Yes, Anita, Jismi, Tinti, anyone? Priya, Athra, Sankita, what do we need to find out? What will happen?
If surgical instruments
if surgical instruments
have been used.
Okay, if surgical instruments are used or have been used, yes.
On a patient who is suspected to have prion
On a
disease.
patient who might have prion disease. So whenever if comes, we are talking about possibilities that might or may not happen. So you can interpret the question as what will happen if. What will happen if surgical instruments are used on patients who might have prion disease. Prion disease. Okay. So we need to find out. So among these three options, we need to figure out what will happen if surgical instruments are used on patients who might have. We are not sure the possibility. There is if the patient has a possibility of being a person with prion disease, what may happen. Okay, so all of you take a second, read the extract. No, not take a second, take 50 seconds and read the extract. That's it. Okay. All right. Okay. Tindy, can you read the heading and the first sentence for me from here till here? Yeah. Unmute yourself. Yeah.
Guidelines. Invasive clinical procedures in patients with suspected prion disease.
So they are talking about doing invasive clinical procedures for patients who might have prion disease. Yes, Tindy, read the first sentence for me, please.
It is essential that patients suspected of suffering from prion disease are identified prior to any surgical procedure.
So prior to any surgical procedure, before any surgical procedure, it's extremely important that we identify the patients who have prion disease. Next sentence, Tindy.
Failure to do so may result in exposure of individual on whom any surgical equipment is subsequently used.
So if you don't do that, if you don't check and if you don't ensure that, that may result in, that may cause exposure. That may result or that may lead for the individuals to be exposed to this particular disease and okay, 1 second. Failure to do so may result in exposure of individual. Okay, so we are using a surgical instrument without checking whether the person who used it had prion disease or not. So if we use this thing on the other patients, it may result in exposure to the disease. All right. Next one. Next sentence, Tindy.
Prions are inherently resistant to commonly used disinfectants and method of sterilization.
So prions are inherently, permanently. Prions are permanently resistant. They to commonly used disinfectants or methods of sterilization. So prions, that particular prions are not affected by any types of disinfectant that we commonly use or any forms of sterilization. They are resistant to it. Okay. All right. Next sentence, Tindy.
This means that there is a possibility of transmission of prion disease to other patients even after apparently effective method of decontamination or sterilization have been used.
So that's why, since prions are very much resistant to any kind of disinfection, disinfectant, that can lead to 1 second. That can lead to the possibility of the disease getting transmitted to other patients, even if we clearly, if apparently means clearly effective methods, even if we use clearly effective methods of decontamination or sterilization on those equipments to clean them, since this bacteria or this particular prion is resistant to disinfection, there is a possibility of transmission of the disease to other patients. Yes. Next sentence, Tindy.
For this reason, it may be necessary to destroy instruments after use on such a patient or to quarantine the instrument until the diagnosis is either confirmed or an alternative diagnosis is established.
So all of you focus on this sentence. So that is why. So they have told that, before the procedure, it's very important to identify whether the patient has the disease. If you don't identify, that puts other individuals at risk on whom they will use the equipments afterwards. Then they have told that, this particular prion is very much resistant to all forms of disinfection and sterilization. That increases the possibility of transmission. So now they're saying that is why it's necessary. It may be necessary to destroy instruments after use on such a patient. If you find out that your patient has the disease and you later on, if you find out, you need to destroy such equipments, or what you can do, you can quarantine. You can keep the equipments in a quarantine until you're sure the diagnosis is confirmed, or if you figure out that prion disease was not the case, the condition was something different. So until they are asking if it's confirmed, you need to destroy the instruments, or you can keep the instrument in quarantine until the diagnosis is confirmed, or until you get this person does not have prion disease, they had something else. Until that confirmation comes, you can keep it in quarantine. Okay, last sentence, Tindy.
In any case, the instruments can be used for the same patient on another occasion if necessary.
So in any case, so whatever be the case, the instruments that you used can be used for the same patient. So if the patient, whether the patient has prion disease and the patient underwent the surgery, or the patient did not have prion disease, you confirm that either whatever the scenario, you can use the surgical instrument on another patient, on the same patient if you want, on another occasion. Okay, you can save the instrument to be used for this particular patient for whom you suspected to have prion disease. You can use it for that patient in another occasions, but not for other patients. All of you, take a second, go through these. So first, they say that it's important to confirm, identify whether the person has the disease. If you don't do that, then you're exposing others to the disease, expose the disease, put the others at risk for whom we will be using the equipment afterwards. Then they are saying that prions are very much resistant to, permanently resistant to all the forms of disinfections and disinfectants and sterilization. Because of that, even after you clean decontaminate the equipment or sterilize the equipment, the possibility of transmission to other patients are still there. As a result, either what you can do, you can destroy the instruments after using on such a patient who has the disease, or you can keep the equipments in quarantine and you can wait for the diagnosis to be confirmed, or you can keep the equipment in quarantine until another diagnosis other than prion disease is made. And whatever be the case, even though whatever be the case, you can use this equipment on the same patient without, if the patient has a prion disease or if the patient has another diagnosis, whatever the case is, you can use this particular equipment on that patient for another occasion, but not for any other patient. Okay? Oh, that's not told. They have told in any, whatever be the case, if you want, you can use the instrument on the same patient on another occasion. That's all. They have not told about other patients. Okay. All right. All of you clear? Here, Binsi, Revati, Chinti, Priya, Adra, Leena, Jismi, Anita, Sangeeta, Kalani, and others. Are you guys with me? Are you clear with this?
Yes, ma'am.
Okay. So we are going to the question. So here again, we have a incomplete question. So, Sangeeta, can you read the first option for me?
Must be routinely destroy as
Sangeeta, with the question. With the question.
Yeah, sorry.
It's okay.
If surgical instruments have been used on a patient suspected of having prion disease, they must be routinely destroyed as they cannot be reused.
Have they said that this one must be? You don't have any other choice. You have to destroy it and you cannot reuse the device. Have they told that?
No.
1 second, they have told there is an option for destroying it, but you can reuse. If you don't want to destroy, you can reuse it on the same patient. So is A the option? All of you take a second, focus on that.
No.
They have not asked routinely you have to destroy. They have told if you want, you can destroy, and if you want, you can use it, reuse it, not on other patient, on the same patient. So is A the answer? No.
No.
Okay, all of you got that? Okay. Sangeeta, next option, please.
If surgical instruments have been used on a patient suspected of having prion disease, they may be used on other patient provided the conditions has been ruled out.
So you can use this. You can use it on other patient as long as you've confirmed that the person does not have the disease. May be used on other patients provided the person does not have the disease. Okay, let's read the last option, Sangeeta.
If surgical instruments have been used on patients suspected of having prion disease, they should be decontaminated in a particular way before use with other patients.
So if we have used the surgical equipments on a person who have prion disease, can we decontaminate and use it on other patients? Will decontamination work? All of you, what do you think? You see the answer?
No.
No. Decontamination won't work. So A is not the answer, because you cannot keep on destroying surgical instruments and not reuse them. You can destroy if you want, but you can reuse them on the same patient. So A is not the option. And they've already told no form of decontamination will work if the instrument has been exposed to prion disease. So C is not the answer. But B is the answer. Take a second, read that. May be used on other patients provided that the condition has been ruled out. You have excluded the condition. You have confirmed that the person does not have that particular condition. Then you can use it. That's why they've told, see, quarantine the instrument. Keep the instrument away until the diagnosis is either confirmed or alternative diagnosis. Alternative diagnosis means if the person has any other disease instead of other than a prion disease, until then you can keep the instrument quarantined. Keep it on hold. So that makes B as the answer. It's a tricky one. All of you take a second, go through it, have a look at why B is the answer. All of you. Ruled out means exclude. Exclude, not find out, it means exclude. So once you have excluded that the person does not have prion disease, the device can be used on other persons, right? That's why they've told it can be kept for, it can be quarantined. You can keep it away. All of you take a second. This is the last question for the day. Take a second, go through this. See, nowhere they have told, one second. They have not directly told use on other patients. This is kind of indirect. They've asked to quarantine the instrument in two situations until the diagnosis is confirmed or an alternative diagnosis is established. So if there is an alternative diagnosis, that means we are sure the person does not have prion disease, then you can use the quarantined equipment, right? You don't have to, you can of course use it on other persons. Only if it's prion disease, we cannot use it on other persons. So answer is B. Sangeeta, Anita, Priya, Adira, Leena, Tinti, Jismi, Kalani, Jayavati, Vinci, and others who have just joined. Are you clear with why B is the answer and why not A and C? Take a second, go through this. And if you are confused, if you want me to clarify, please ask. It's a bit tricky. A is not the answer because of course you can reuse it on the same patient. So when they say it cannot be reused, that is wrong. Routinely destroyed means every time you cannot keep on destroying it. So that is not the answer. C is not the answer because it's clearly told no amount of decontamination will work if the patient might suspected of having prion disease. You can decontaminate in a particular way and use it for other patients. No, they have not told that. They have nowhere they have highlighted or mentioned any decontamination in a specific way. That's not mentioned. So C is not the answer. A is mentioned, but it's opposite of what the detail is different. They said about destroying, they said about reuse, but it's not the same as given in the A option. And the C, no way they've talked about a specific way of decontamination. B is the answer because they have told you can keep the instruments in quarantine. Keep it hold for some time. Keep it away from some time. Or if it's alternative diagnosis is made, then no problem, right? You can use it on other people. So answer is B. All of you with me? Any questions for me? Okay, all right. So that's what that is. So this is how you approach part B. Am I audible to you guys?
Yes, ma'am.
Okay, all right. So this is what we do whenever you get a part B. I told you get guidelines, you get memos, you get all this notice, emails, and policy documents. Whenever you get, read the question, analyze the question, do this particular step. Analyzing is not at all complicated. Just think, what have they asked us to find out? Once you do that, go to the text, read the text and understand the text very clearly. Then, only then, go for the option. And if your question is incomplete, read the question. When you read the option, read it together simultaneously with the question. So that will give you a clarity about the meaning of the options. So you will be able to eliminate the wrong ones and choose the most appropriate ones. And never do matching. Okay, my extract has the word clinicians. The option has the word clinician. So that is the answer. No. Don't do the matching thing. Understand the meaning. And when you approach or when you practice part B, you set a timer for 13 minutes and practice part B. Okay, all right. So any questions for me? Do you guys have any questions that I can clarify? Anything? Anything? Okay, so before I wrap up the session, let me just review what we have discussed today. Just quickly go through, and as you can see, I've added everything on board. On the screen. So just go through it quickly, all of it. So out of 6 questions, I would say your goal should be to score 4 to 5 out of 6. 4 to 5 out of 6. Okay, 4 to 5 out of 6. So part A, I told you 18 out of 20. Part B, 4 out of 6. These are the types of extracts that you get. These are the types of questions they will ask you about the main idea, purpose, detail. This is the strategy that I would advise you to follow. Take a second, go through this. I wouldn't say 2 minutes, 1 minute to read. 1 solid minute, read the extract. No, you can take 2 minutes. Today I put 50 seconds, but when you practice, you can use 1.5 minutes to read the extract. 1.5 minutes. So I would say when you read the extract, today I put 50 seconds, but when you do it because of the session and everything, but you can take 1.5 minutes to read and understand each text. So total you will take around 7 minutes to go through the extract each, then you will have time. Okay. So at least spend 1.5 minutes to read and understand the text. Okay. So, okay, in total, around 8 to 9 minutes, you will be out of 13 minutes, 8 to 9 minutes, you will be reading each extract. Okay, 1.5 minutes for each extract. Okay, all right. So, Binsi, Anita, Revati, Jismi, Priya, Athira, Siji, any questions? Sankita, any questions? Okay, all right.
No, ma'am.
Okay, so those who are students of Langfort, you can get the video of this session and yesterday's session. Just send a message to Jia ma'am. I'm sure she has already shared that in the group. You can contact her and you can get the link and you can go through all the sessions that we do on a weekly basis. So yesterday it was part A. You can collect the recordings. You can get the link. Today it was part B. You will get this recording as well. Tomorrow we will be focusing on part C. Okay, so that's it for today. I hope I was able to, convey myself clearly to all of you. If you have any questions, you can talk to Jia ma'am, and recording you can collect it from her. Okay, all right. So that's it for today. I'll see you guys tomorrow. Make sure to, sir has clearly told me, all of you, make sure to subscribe our YouTube channel, Instagram, and FB. Okay, all right. So you will be able to get the links very as soon as we arrange these sessions. You will be able to get the link and you will be able to get grammar practice and other speaking videos and everything. Okay, all right. So that's it for today. I'll see you guys tomorrow. Okay, all right.
Thank you.
Thank you.
Thank you, ma'am.